Has your quality of life been compromised and you no longer feel your usual self? Do you find yourself frequently having to search for toilets wherever you are? Or do you frequently wake up at night to urinate? Or do you perhaps have difficulty starting urination? If you find yourself experiencing any of these, then you might be suffering from BPH. BPH, short for benign prostatic hyperplasia or prostate gland enlargement, is a common condition in older men. About 50% of men by the age of 60 have BPH, with that number jumping to 70% by the age of 70 and to 90% for men over 85 years of age. If you have a family history of BPH, have pre-existing medical conditions such as obesity, heart and circulatory disease, type 2 diabetes, or just lack physical exercise, then you are more likely to develop BPH as you age. When the prostate gland enlarges, it can cause discomforts such as a sudden, strong urge to urinate, be it day or night, difficulty starting urination, leakage with little to no warning, weak urine stream, intermittent urination, inability to completely empty the bladder, a painful, burning sensation during urinating, or in more severe cases, blood in the urine. If left untreated, you may develop serious conditions that require medical intervention, including complete blockage of the urethra, damage to your kidneys, urinary tract infections or UTI, bladder stones and bladder infections. But do not worry. There are treatments available for BPH. The conservative treatment option will be changing your lifestyle and diet, or taking BPH medications commonly known as alpha blockers. Depending on each person, the side effects of this medication may include retrograde or abnormal ejaculation, erectile dysfunction, or hypotension, or what we call low blood pressure. Despite this, the conservative option is usually suitable for most patients with mild to moderate symptoms. If your symptoms are more severe, then you may want to consider surgery or more invasive procedures such as lasers, transurethral resection of the prostate or TURP, and prostatectomy, a surgical procedure for the partial or complete removal of the prostate. Some risk factors for these invasive methods may include bleeding risk, especially for patients on blood thinners, as well as loss of sexual function. If you are looking for a treatment option that is conservative and with low risk involved, you may want to consider water vapor therapy. Water vapor therapy is a minimally invasive treatment, which uses the natural thermal energy contained in just a few drops of water to shrink the prostate. This procedure is fast, safe, effective and minimally invasive, all while preserving sexual function. It is a day surgery, and it is possible to be carried out under local anesthetic. Side effects are generally mild, last only a short time and typically go away within a few weeks. There were no reports of new instances of erectile dysfunction or ED. Patients will go home with a catheter to aid the healing process. Within 3 months, patients may go back to their usual activities. If you are concerned that you may be suffering from BPH or you are in any of the risk groups, schedule an early screening or consult your urologist to get a proper diagnosis. Resume your life to the fullest. Why wait?